Hi, I'm Dr. Eli Sheff, and welcome back to our interview series with the Sexual Health Alliance. Today, we have the tremendous pleasure of speaking with Danielle Carlson and Cindy Trawinski from Lifeworks in Chicago. Danielle and Cindy, welcome. Please introduce yourselves.
Thank you.
Thank you. Thank you so much. I'll start. My name is Cindy Trawinski. I'm a psychologist, clinical psychologist in Chicago, and one of the founders of Lifeworks Psychotherapy Center. We have 3 offices in the Chicago area and suburbs, and our practice focuses mostly on LGBTQ clients, polyamorous or non-monogamous clients, kinky, and clients exploring BDSM, as well as former and current sex workers.
I'm Danielle Carlson. I'm a licensed marriage and family therapist, and I'm the director of training at Lifeworks, which means I run our Greenhouse Fellowship program and also facilitate our Kpact training series for clinicians in the area.
Wonderful. Thanks so much for coming today. So how did you all get involved in serving such a diverse community, especially sex workers? I hardly ever hear of anyone, I hear about political activism related to sex work, but in terms of a therapeutic specialty, that's so unusual. How very interesting of you.
Eli, I think you know Rami and I were doing some training in process-oriented psychology out on the West Coast, and part of our training, we had to create a kind of community service to get involved with a particular group, and coincidentally, we were surfing around, Rami was, and she found a request for a polyamory support group. So that was kind of in the works even before we started Lifeworks. And that came out of our relationship, which we're both in a polyamorous relationship, and our own interest in meeting other people and learning about how other people were structuring and dealing with their relationships and relationship issues. And then when we started Lifeworks in 2012, it just seemed natural that people who were in that group would also need psychotherapy services, and that it might be a way to reach that community, which it has been. We had a brief foray in running a kink support group, which went on for about 2 years, but didn't have quite the momentum. The poly support group has had, we get 35 to 45 people a month in that group. It's an open group, and it's been going for 11 and a half years at this point.
Wow.
So right now, because of the COVID, we're meeting on Zoom, and we're still getting a really great attendance, which is just, I think, a testimony to the need and the kind of vibrancy of the community in Chicago. We got into connection with the sex work community through one of our greenhouse therapists, actually, who introduced us to someone at SWAP, the Sex Worker Outreach Project. And they, knowing of our work with support groups, asked if we would be willing to co-facilitate a group for sex workers. So that's really how we bridged over to that community. And it's been an interesting experience, and we've all learned a lot. And like every marginalized group, sex workers have their own special needs, and we are doing our best to learn and to respond to those concerns and issues in our practice.
Mm-hmm. Yeah, I'd also add just that I think that because we really understand that all of our clients and our therapists have a lot of intersecting identities, I think it's like an openness to bringing in those intersecting identities that start to grow the different populations we serve. So many of our own therapists and our clients, are polyam, but they're also a sex worker, they're also queer, they're also kinky, right? So it felt to us just really important to really start to include sort of the wholeness of people in that way and the different ways in which they hold these identities. So I think that also is part of the Lifeworks value system to bring that in.
That's fantastic. Danielle, what can you tell us about the Greenhouse program?
Yeah, sure. So our greenhouse program is in its 5th year this year. We have a cohort of 6 fellows. And what we really work on with the greenhouse program is taking new or recently licensed clinicians, recent grads, into thinking about 3 main areas. So one is depth psychotherapy, which is really a big focus of Lifeworks, and part of when Cindy and Rami and Pat started it, a big focus of the work they did. And then secondly, the populations we serve. So there's a strong focus on the cultural competency around those populations. And then third is therapist identity. And a lot of actually what we hear is that young clinicians are really looking for a place to really develop their therapist identity and really understand their own experience of their work, their own experience of the clients, and that really grows their confidence. So those are really the 3 prongs. And the sort of basic nuts and bolts of it is they do clinical work with us, they do didactic training with us, and then they get one-on-one supervision as well as group work.
And so is this part of a degree or a certification or something like that?
You know, it's a 1-year fellowship program with us. It's really, you know, I guess we give them a certificate at the end. So they get that little certificate from us, but it's not part of any formal degree or certification. But I think that there's a lot of meaning in completing the program.
And with that kind of supervision, that would also satisfy the requirements of various degrees. I know ASECT, for instance, the American Association of Sexuality Educators, Counselors, and Therapists wants their professionals to undergo supervision. So that's really valuable. To me, to find supervisors who have that degree of experience in an area that's not as common. It can be very difficult to find education. And the
absolutely
minded supervision is really, I think, incredibly valuable.
And we put a lot of focus on the supervision in the program. All of our supervisors meet together bi-weekly to really deepen their understanding of the supervision and focus on how we're offering that supervision and train themselves. So that's a big part of our program as well. Yeah.
Fantastic. What is Kpact?
So Kpact is the acronym for the Kink Poly Aware Chicago Therapist Group that we founded in 2014. Really out of our need at Lifeworks to identify and find other therapists who were interested and able to work with kinky and poly clients in an affirming way. And, you know, we just didn't know enough people. And so we said, well, why don't we hold an event and invite a lot of people? And out of that grew this idea of having just an ongoing education platform where we could network, dialogue, and train with other therapists around issues of relevance to those communities.
Fantastic.
So right now Kpact offers 3 education events a year. Those are usually CE bearing. And we have in the past tried hosting some social events. And of course, you were kind enough to come up to Chicago and offer to do a full day workshop for us, which was really wonderful. And so we're growing and connecting with a lot of other therapists in Chicago who are interested in serving the polyamory, non-monogamy community, as well as the kink and BDSM communities.
Do you have more to add, Danielle?
You know, I think that it's been a really good space because it's really about clinicians sharing with each other. We don't charge for it, and our speakers offer the speaking themselves without pay. But it's really about sharing that together and connecting and networking. And Cindy likes to talk about how there's always been in the early days really this sort of joyful bringing together of clinicians, and there's a little social hour and things like that. So we're really trying to create a bit of community beyond just the learning as well.
We have a website for Kpact, kpact.xyz, and there's also a private Google group for therapists so that we can share resources and referrals and different kinds of events that might be of interest to people.
Great. And so can they find that Google group via the Kpact website?
Yes.
Great.
Yes, exactly. A little pop-up will show up when they get to the Kpact website. They can just sign on there.
I wonder if you have any parting words for therapists and counselors who are watching this series and would like to effectively serve people in polyamorous and other consensually non-monogamous relationships. Danielle, can we start with you?
Sure. You know, one thing I really try to share with people is so important about when we talk about cultural competency and learning about groups, it's really not just about learning the information. It's about developing really a deeper understanding of the experience of your clients and also your own experiences, either yourselves or personally with people you know. And so that when you come to working with a client, it's not that you're blindly for or blindly against something, and because that actually doesn't allow a lot of curiosity and exploration for people. So I think really the biggest thing to know about learning about this is try to develop a deeper understanding so that you can come into a session really open and curious about all the aspects of someone's experience with polyamory and non-monogamy, and not sort of sure you're on one side or the other. So that would be my biggest tip, is to try to get to that point.
I think there's different levels when you think about working with polyamorous relationships or clients in therapy. I mean, there's the individual experience that has to do with a person's own identity and how they're coping with taking on the identity of being polyamorous or non-monogamous. But there's also then the relationship level, which has to do with how they're relating to their partners and how that constellation is configured, and are there children or other people in the picture, and how do you work with that complexity? That's like a small group process in itself. And then there's all the issues that have to do with how do those clients relate to the communities that they're embedded into, their jobs, to the schools their children attend, to you know, the local park district pool when they take their kids out swimming. And finally, there's the relationship just to the world. Like, how is the world interacting with people who are polyamorous, people who are in consensually non-monogamous relationships? What are the laws like? What are the limitations in terms of immigration, in terms of just all the things that as cultures we try to cast out for people in countries and in different kinds of states or municipal communities. I think those are all big issues that affect people, and that it's good for clinicians to be thinking about, that it's not just one set of issues, but it really occurs across a spectrum of locations in the person's life that they're facing. What is that like, and what can they do to address those kinds of concerns?
Wonderful. Well, thank you both so much for your time and for the work you do on behalf of equality for sex and gender minorities and for sex workers and for people who, you know, you're serving populations that are far too often overlooked. And I really appreciate what you do. Thank you. And thanks for your time.
Thank you.